Good afternoon, and thank you for joining me today. My name is LLowry. I'm a hands-on healer with a private practice, and I'm also a registered nurse working at a local hospital in the critical care unit. And I'm here to talk to you today about coping and resilience in the face of fear. You know, it's something that I think we can all really relate to right now. When I was reading the news this morning, I was looking at the New York Times and a couple of the headlines. In Portland, we have our military tear gassing our own citizens. In New York City, we have police in riot gear clearing out City Hall. We have over 3.9 million cases of confirmed COVID in the United States, and more than 78,000 in Florida in the last 7 days. You know, it reads like something out of a post-apocalyptic novel, or Batman's Dark Knight movie. But seriously, it can be scary. And I know that there's a lot of my colleagues, fellow nurses, that are out sick, and they're sitting at home and they're worried. They're worried about their families. They're worried about their paychecks. They're worried about how their kids are doing in this time of quarantine. And maybe you share some of those concerns. So my question is, what do you do? Do we look for ways to distract ourselves? And are those distractions helpful? You know, I see a lot of my clients and they're coming in and they're complaining of insomnia. They're not sleeping well. Or they're doom scrolling through the news all day and it's not helping how they're feeling. Or they're snacking all day long. Most of us know we go to patterns like these, but they're not helping us. They're not getting us to feel more resilient. They're not helping us cope. In fact, they may make us feel worse about each other. So what do we do? Imagine if Indiana Jones had reacted when adventure called and said, nope, it's too dirty, it's too sweaty, there'll be snakes, I'm afraid, I'll get shot at. He wouldn't have engaged with his adventures. He would have been sitting at home worrying. And if he'd done that, he wouldn't have gotten the girl. He wouldn't have gotten the treasure. He would never have found the Holy Grail. And it's the same for us. If I'm sitting at home and I'm focused on what I'm worried about, I'm focused on what doesn't feel well, I'm focused on, for me, you know, going back to work is going to be hard. It's sweaty. My face is going to hurt from the mask. I'm going to be afraid. I'm going to see things that are painful and terrible. If I sit in that place, how am I going to feel resourceful? How am I going to feel like I can do this? How am I going to move forward? Well, we need to be more like Indiana Jones, right? Here's where I want to introduce you to a very favorite tool of mine. It's called Emotional Freedom Technique, or EFT, or sometimes just tapping, because it involves tapping on acupressure points on your face. So what is EFT? Well, it's a method that combines cognitive behavioral therapy with a somatic component, tapping on these acupressure points, these specific 8 points on your face, with a cognitive script that you go through as you're using it. And by combining these 3 techniques together, EFT has had some really fantastic results. According to a 2019 review of the evidence in the British Journal of Community Nursing, there are over 100 peer-reviewed studies that indicate significant positive outcomes with EFT for anxiety, for aggression, for post-traumatic stress disorder, for addictions, for phobias, for insomnia. And it's not just for emotional or behavioral issues as well. There's also many studies that show this works on physical factors like chronic pain, fibromyalgia, cancer pain, arthritis, chronic fatigue, irritable bowel syndrome. So you might be asking, how can it work on everything? How can anything work on basically everything? And it's actually very simple. The reason that EFT is so effective is because it works on 3 critical components at once. So the first is the physical. We know that EFT has a powerful effect on the parasympathetic nervous system, the part of our autonomic, or you might think unconscious, part of our nervous system that helps us to relax and to heal. It helps lower that stress response. A 2019 study published in the Journal of Evidence-Based Integrative Medicine was able to quantify some of these effects. It showed a dramatic decrease in blood pressure, in your resting heart rate, and it also showed increased cerebral blood flow. Now, why is that important? Well, the reason it's important is when you get increased blood flow to these certain areas of the brain, you increase release of the neurotransmitters serotonin and dopamine. And when you do that, those are your happy endorphins. You feel good. You feel good. Feeling good is important. It isn't just about, oh, are we supposed to feel good? You need to feel good in order to feel calm, in order to feel competent, in order to feel confident, in order to feel like you're ready to take on an adventure. This same study also showed a 37% reduction in cortisol levels. And cortisol is your stress hormone. So if cortisol is up, you're releasing adrenaline. If you're releasing adrenaline, you're getting these physical signals that you're in danger. You're getting physical signals that make your heart race, that make your blood pressure go up, that make your body be ready to fight or to run. And that can translate into emotions. You can feel more nervous. Your anxiety can increase. You can have a snack attack. A lot of times, if we're constantly under those kinds of physical signals, and we're constantly feeling those kinds of stressful emotions, then we develop behavioral patterns that don't really serve us. We fall into habits that are meant to make us feel better, but they're based on avoidance. They're based on distracting ourselves. They're not helping us to move to some place where we're actually more competent, or we're actually in a better frame of mind. They're just trying to help us not feel so much, numb out, if you will. And if these patterns continue long enough, they can develop into things that are a little bit more problematic, like addictions or phobias. So this is important stuff. So EFT addresses the physical component. It also directly addresses the emotional component. It gives us a way to process emotions and not get stuck in a certain place. So one thing that we know is that really strong emotions or traumatic experiences they get sort of locked into our memory or our neuronal processing at this high intensity level. So they're literally stored differently than our normal memories or our normal experiences. And from a therapeutic perspective, the question then becomes, okay, if I've got this trauma and it's stored at this very high intensity, and I want to now start working on it and try to release it, how do I access it again? Because here's the catch: if you're going to try and ramp up the intensity to the original level of the experience, then you're going to cause rewounding again. You're going to cause re-traumatization. If somebody's had a really terrifying experience, they've been in the ICU, or they've had a car accident, or their husband or their child has gotten sick with COVID, you can't just process that experience by saying, let's go right back into it. Let's relive everything that was so difficult about that. It causes people more pain, and it puts those negative patterns more deeply etched into our brain chemistry. And then these feelings of fear and nervousness and insomnia, they just get worse instead of better. So using EFT or tapping, combining the physical, the cognitive, and the emotional, putting it all together, it gives us a way to very gently access those experiences one step removed. And what we're finding is that we're actually able to get repatterning, both at the physical neural level, but also in the cognitive level of patterns and habits, and in the emotional level of how people report they feel, their subjective reports. When you clear out these physical and emotional barriers to relaxation, then you're able to lower the cortisol levels. You're able to release old patterns and make way for new ones. And you're able to return to this place where you are calm and confident. You're resilient. You are able to respond to what's in here now, and not just based on patterns that have developed in the past that may not be serving you anymore. The final reason that EFT is so effective is because in addition to the physical and emotional components, there is a cognitive component. It came out of work with cognitive behavioral therapy and exposure therapy for post-traumatic stress disease. So it came out of work of how do we help people think about their experiences differently. But EFT is a lot more effective than just therapy alone because it's bringing in these unconscious and physical and neurological and body chemistry pieces. And it's doing it in a way that's very accessible and very simple. It's something that anybody can learn in a couple of minutes. It doesn't cost anything. And it doesn't take years to work. It takes a couple sessions to work. That's pretty amazing stuff. In conclusion, EFT is a tool that you can use right now to lower your stress and to help yourself become more resilient, more joyful, and more calm. EFT is like Indiana Jones's hat and whip. He would never go on an adventure without those things. They made him feel confident. They made him feel prepared. They made him feel ready for anything. EFT is going to help you face whatever comes your way. It's going to help you feel calm and confident and competent. Marcus Aurelius said, "You have power over your mind, not outside events. Realize this, and you will find strength." You know, that was true 1800 years ago. It's true for Indiana Jones, and it's true for us. We can't control the news, the politics, the future. We certainly aren't in control of COVID right now. But we can use EFT as a powerful tool to access our inner strength and resilience. And that, my friends, is the real treasure. Thank you so much, and have a good day.